Good morning, everybody. I'm Valerie Wolf. I'm the Executive Director of the South Central region of Ontario for the Occupational Health Clinics for Ontario workers. And I would like to welcome you to this year's fourth iteration of Mayday Mayday. Very, very pleased to welcome our Canadian audience, but particularly the international audience that we've gained through our partnership with the COPSOQ network, with whom we've been working for several years, and they've really expanded our knowledge and understanding of how workplace mental health is so affected by organizational decisions and so affected by things that happen in the workplace, but it's treated differently and handled differently in so many different countries. And so it continues to be, with today's presentation, helping us gain understanding of the commonalities and as well as the differences, and hopefully all the stories shared are for us, they're lessons learned, we call them, in order to inform other possibilities that we might be able to try with our own workplaces or in helping others. So, and actually, I was going to mention that OCA has done the COPSOQ survey 3 times, and I would not say it gets any easier because so much changes in between, and some of the participants and the workforce changes, and it's always a new picture, a new snapshot, but mostly it's a tool for dialogue and joint problem solving in the workplace. So I'm very happy to turn the hosting over this morning to the COPSOQ hosts, Juan Perez and Emily Dupre, and they can lead us through these stories that will help all of us, I think, in our work and in our own work, gain understanding about the impact of work on our health and how we can make a difference in whatever role we're playing. So Juan and Emily, over to you.
Okay, thank you, Val. I'll start to introduce myself. I'm Emily. I'm in the steering committee and represent France, as you can hear in my accent. And what I wanted to say to introduce all this presentation, it's that the COPSOQ came into my life 13 years ago, and it changed my life as an occupational psychologist, of course. The main asset of this questionnaire is to give a wonderful overview of psychosocial risk factors, and it allows as well to establish a link between work environment and condition and their effect on well-being at work. And all this with a very few questions, very limited number of questions, so it's a real challenge. And COPSOQ is a great tool for those who want to get to the bottom of things and want to find concrete solutions, really. If you or your client don't want to face your strength or your area of improvement, then I would say don't use COPSOQ, because it really shows what you have to work on and what is your strength. And moreover, what I want to say is, to my knowledge, there are no other experience of an international tool and network than the one with the COPSOQ. Okay, things are not perfect. We'll see through the presentation. But it's already a challenge to get everyone to agree at the scale of a company. So let's imagine at the scale of the world, the challenge it is. But here it is, the network works, it's living, we meet every month. So it's really something special with the COPSOQ. But more than blah, blah or statistical approach, I think the best way to understand the power of the questionnaire is to listen to intervention stories, and that the purpose of today is to hear about real life experience, to see what we can, what opportunities the COPSOQ can give. So I hope you enjoy the full presentation that we are about to hear. Juan?
Morning, everybody. We will have 5 minutes for discussion at the end of each presentation. Are you ready, Elise? Then the first presentation is from France, And the speaker is Elise Chimol. That's right, your last name. And this will be about how to develop the COPSOQ in a large multinational common company, a common project. Elise?
Thank you, Ron. So, hello everyone. My name is Elise Chemol, occupational psychologist at Preventis, a private company. So, it is a pleasure to share with you one of our practices of the COPSOQ 3 French version. So, the intervention example we are going to present today is about a client based in France, but also a large multinational company. And the reason why we believe it is relevant to share it with you is because we are currently working with this company on the international deployment of the COPSOQ 3. To start, I will give you a brief description of the company. So, as I said, it is a French company, which means that the head office is based in Paris, with several sites in France. For the moment, with Preventis, we have only worked in France, but the company is established in over 150 countries, so all around the world. And like many companies, one of its current challenges is the development of sustainable social performance. They are already relatively exemplary on these subjects, and especially about the development of their French model in other countries. The assessment of psychosocial risk is now part of their new target. They really want to use the COPSOQ in each country where they are established. For us at Preventis, the story with the company began many years ago. They decided to assess stress and other mental health indicators as early as 2008. And they chose to work with us, an external and private consulting company specializing in the prevention of occupational health. In the early years, the focus was on the concept of stress. We added anxiety and depressions, which, as you know, medical concepts, because they didn't want to create stress factors just by deploying big questionnaire about working environment in 2008. So we only used a custom question that they could choose from. So there is a deployment since 2008 to 2011 in several sites in France. And over the years, the tool has been a success, and the corporate culture has been evolving. And let me explain how. So in France, psychosocial risk assessment has become more and more important over the years. So our clients needed to make some evolutions on the question to ask their employees. So they questioning the tool and have new target in 2018. They decided to keep medical concepts, stress, anxiety, and depression for individual assessment, and they choose to add the COPSOQ as a survey without any link with occupational health services. And after many discussions, the first survey took place at the first semester of 2019, and it was a success. So the first one was a success. And before they had 3 mental health indicators. Now with COPSOQ, they have 24 dimensions. So as you can imagine, 2020 was so challenging to deploy this survey on all French sites. But for sure, now 2021 is a good year. And I can tell you we have a lot of workload now. So now let me describe this international deployment. Here is what works in France and what we do. So firstly, we need involved people. Concretely, this means executive committee sponsoring the project, but also co-construction by both human resources services, and occupational health services. Then we need 3 to 4 weeks to reach a good participation rate. A good participation rate means 50–60% of employees. We offer an anonymous survey and define with the company a threshold of 20 respondents. Of course, after the quality of statistic analysis is very important to ensure the reliability of the results. So we use an external French panel and internal comparisons to identify strengths and weaknesses. The final step of the assessment, but also for me and for us, the success factor of such project is the presentation and the discussions around the results between internal stakeholders. Here are some examples of results by dimensions. First, the comparison to an external panel, evolution compared to the first survey, and internal analysis to identify groups on which it will necessary to pay attention. I think I don't need to describe more. It's only example of the results. So now let me share the added values of COPSOQ for this company as identified the executive committee. One, they could keep control on this topic of psychosocial risk assessment, but also integrated a co-construction work with unions. Two, they now have a lot of indicators to know their strengths and weaknesses on a large scope of dimensions. And three, they have established an operational action plan and designed a specific training for their managers, for example. So it took many years, but added values of the COPSOQ is clearly identified for this company. And to finish the presentation, let me now share how we intend to develop the French success story all around the world. And this is how that we are currently starting the international deployment. We are working on this with Julie and Christine, my colleagues. And first of all, we need to involve local stakeholders of the company and identify their requirements. The aim is to reach a good participation rate, so we have to know and to be sure to do this in all countries. We also have to have the same versions of COPSOQ for each country, so we have to think about, of course, we have to have COPSOQ versions based on core items, but we also have the COPSOQ free French versions that the clients already know. We have to check the compliance with local regulatory framework for each country. We also have to define analysis method. So this is a very important topic for us, because we need a comparison of a local panel, because this is what we do in France, and how to have it for each country. So it's a question with many answers, because there is many countries and different contexts. And we have to think about and decide between us, but with the client too, which priority do have to focus on comparisons with local panel, or comparisons between countries. So there is many kind of point of view, many kind of analysis possible, and we have to think on this. And so the last point, we are sure we have to cooperate with local networks members, so with you on these different points. And we know it's not easy, because it's not the same on each countries.
Elise, 2 minutes left.
Perfect. I think it's the end for me. It's the last one. So I hope it was clear for all of you. And I'm sure my colleagues, Julie and Christine, can complete if we need some explanation.
Okay, thank you, Elise. And we have now 5 minutes for questions and answers, of course. Anybody want to make a question? I have a question, Elise. I have a question. My question is, if you have a comparison, a benchmark in France with a working population, for just to contrast the questionnaire, have you won something like a benchmark in France?
So, if I understand your question, in France we have an external benchmark. This is a representative of the employees in France, and this is I think this is the key analysis of our results. So now we have this in France, but we don't know how to do the same in other countries.
Okay, thank you.
I have a question, Juan and Elise. Yes. I was wondering, is the international network of the COPSOQ, can be useful for you in this development in different country? Can you lay on this network to help you?
Yes, I think we really need COPSOQ network to identify the country where it should be easy to cooperate, and other country where it could be more difficult. As you said, John, what about countries without COPSOQ partners? So
Yes.
we have to think about it, and it's not easy because now our clients they don't know which country could be the first one, and how many countries, because it depends on the policy in the company.
Two other questions, Elise, from Terry Zimansky. Is there competition with our service there? Yeah, we find that organizations have engagement surveys they want to use. Yes, so that one. And the next from Yera is, can you maybe more specific about in which countries you search cooperation? The two questions.
Okay. So I think for the first one, now we have no competition with other survey in this company, so they chose COPSOQ. So for this point, it's okay. We have engagements survey. We have one in this company, but I think maybe it is one of our success. But we arrived to make the difference between their engagement survey and the COPSOQ, because for us it's really not the same, and the client is okay with our point of view now. It's not easy at the beginning. It was not easy, but now it's okay. And for the second questions,
about which countries you search cooperation?
Yes. So we are not sure about this because a few months ago, our client told us about China, and I think 2 months ago they talked about Russia. So it depends, and now we don't know which country will be the first ones because I think it depends on human resources directors established in each country. So in China, it's a French one, so maybe it could be important, but we don't know for now. We have a next meeting with the clients in 2 or 3 weeks, and at this meeting, I think we will know, but not now.
Okay. We have many comments, not exactly questions, but comments from many of you. We have a little time. So in Canada, don't have their own data, the reasons with the Danish data, the Russian version, yes.
Okay.
There's a short Chinese version, yes. Yeah, there's a short Chinese version.
Okay, Taiwan.
Okay.
I can see Herman. Thank you for Taiwan, because this is a country interesting too.
Thank you very much for your presentation. You're very interesting because it makes us to think about how it is to make this in many countries. So it's not easy to make it, to conduct
so
a questionnaire in many countries. Okay, so thank you for you, Elise. And we have to, this is the end for your presentation.